The scope and purposes of HT and HTA. Health technology. There are three ways to describe health technology: its physical nature, its purpose, and its stage of diffusion. Number 1. Physical nature of a health technology. For many people, the term technology connotes mechanical devices or instrumentation. To others, it is a short form of information technology, such as computers, networking, software, and other equipment and processes to manage information. However, the practical application of knowledge in healthcare is quite broad. Main categories of health technology include the following. Drugs, such as antihypertensive agents, antivirals, antibiotics, cancer chemotherapy. Biologics, such as vaccines, blood products, cellular and gene therapies. Devices, equipment, and supplies, such as cardiac pacemaker, magnetic resonance imaging scanner, surgical gloves, diagnostic test kits, mosquito netting. Medical and surgical procedures, such as acupuncture, nutrition counseling, psychotherapy, coronary angiography, gallbladder removal, bariatric surgery, cesarean section. Public health programs, such as water purification system, immunization program, smoking prevention program. Support systems, such as clinical laboratory, blood bank, electronic health record system, telemedicine systems, drug formulary. Organizational and managerial systems, such as medication adherence program, prospective payment using diagnosis-related groups, alternative healthcare delivery configurations. Certainly, these categories are interdependent. For example, vaccines are biologics that are used in immunization programs, and screening tests for pathogens in donated blood are used by blood banks. Number 2. Purpose or application of a health technology. Technologies can also be grouped according to their healthcare purpose. Prevention. Protect against disease by preventing it from occurring, reducing the risk of its occurrence, or limiting its extent or sequelae. Examples are immunization, hospital infection control program, fluoridated water supply. Screening. Detect a disease, abnormality, or associated risk factors in asymptomatic people. Examples are pap smear, tuberculin test, screening mammography, serum cholesterol testing. Diagnosis. Identify the cause and nature or extent of disease in a person with clinical signs or symptoms. Examples are electrocardiogram, serological test for typhoid, X-ray for possible broken bone. Treatment. Intended to improve or maintain health status or avoid further deterioration. Examples are antiviral therapy, coronary artery bypass graft surgery, psychotherapy. Rehabilitation. Restore, maintain, or improve a physically or mentally disabled person's function and well-being. Examples are exercise program for post-stroke patients, assistive device for severe speech impairment, incontinence aid. Palliation. Improve the quality of life of patients, particularly for relief of pain, symptoms, discomfort, and stress of serious illness, as well as psychological, social, and spiritual problems. Although often provided for progressive, incurable disease, palliation can be provided at any point in illness and with treatment. Examples are patient-controlled analgesia, medication for depression or insomnia, caregiver support. Not all technologies fall neatly into single categories. Many tests and other technologies used for diagnosis also are used for screening. An example is the reverse transcriptase polymerase chain reaction test. It is used to screen COVID-19 positive patients, and at the same time, also used to diagnose and identify recovery from infected patients. Some technologies are used for diagnosis as well as treatment. An example is the implantable cardioverter defibrillator. It detects potentially life-threatening heart arrhythmias, and delivers electrical pulses to restore normal heart rhythm. Certain hybrid or combination technologies combine characteristics of drugs, devices, or other major categories of technology. An example is the metered dose inhaler. It delivers the drug using a metered inhaler, a combination of drug and a medical device. Number 3. Stage of diffusion of a health technology. Technologies may be assessed at different stages of diffusion and maturity. In general, healthcare technologies may be described as being future, in a conceptual stage, anticipated, or in the earliest stages of development. Experimental, undergoing bench or laboratory testing using animals or other models. Investigational, undergoing initial clinical, in example, in humans, evaluation for a particular condition or indication. Established, considered by clinicians to be a standard approach to a particular condition or indication and diffused into general use. Obsolete, outmoded, abandoned, superseded by other technologies or demonstrated to be ineffective or harmful. Often, these stages are not clearly delineated, and technologies do not necessarily mature through them in a linear fashion. A technology may be investigational for certain indications, established for others, and outmoded or abandoned for still others. Many technologies undergo multiple incremental innovations after their initial acceptance into general practice. A technology that was once considered obsolete may return to established use for a better defined or entirely different clinical purpose.